Hello, my name is Karina Hughes, a nurse and passionate doctoral student working alongside the Pathways Beyond Birth Clinic at the University of Kentucky. I have the opportunity to provide a brief overview of the importance of preconception care and of how it can be implemented in your practice. The goal of this module will be to make available strategies and resources to promote the reproductive health of women with substance use disorders in a variety of clinical settings, including correctional facilities, offices, and remote clinics. At the conclusion of this activity, participants should be able to discuss the importance of preconception care, integrate reproductive health planning into their routine practices, engage in reproductive health shared decision-making, and lastly, be able to use point-of-care resources to support evidence-based reproductive health planning. Epidemic levels of illicit substance use has been seen throughout the nation. In a 2012 study, more than 42% of the identified 41.5 million illicit drug users were women. Due to women's increasing report of drug use and emerging drug-related issues, innovative resources are being explored and established to better their overall health. One specific target area impacted by substance use is reproductive health, especially pregnancy outcomes. Women with substance use disorder have 2 to 3 times the rate of unintended pregnancies compared to the general population. Unintended births coupled with high-risk behaviors, including substance use, are significant factors in negative birth outcomes. It has been estimated that the number of women with an opioid use disorder at labor and delivery quadrupled from 1999 to 2014. Substance use during the preconception period is linked to an increased risk of stillbirths, neurological complications, increased intrauterine growth restriction, and additional negative birth outcomes. It is also important to note that even methadone and buprenorphine, although minor in comparison to cyclic illicit drug use, these drugs do carry the risk of affecting the fetus and of causing withdrawal symptoms once the fetus is delivered. Neonatal abstinence syndrome, NAS, is a collection of withdrawal signs infants can experience from being exposed to illicit drugs in utero. Neonatal withdrawal symptoms represent a prominent concern in the nation. Almost 55 to 94% of the infants exposed to illicit substances will experience these withdrawal symptoms. In Kentucky, there were 1,257 cases of NAS reported in 2016. That equates to almost over 100 new cases of NAS a month. This syndrome can cause extreme discomfort to a child, higher healthcare costs, long length of stay periods, and ultimately, it can be prevented. Most available reproductive health conversations among women with substance use disorders are related to substance use during pregnancy. Although just as important, one of the most important conversations surrounding a woman's reproductive health occurs before a pregnancy and is defined as preconception care. Preconception care refers to any preventative, promotive, or curative health care intervention provided to a woman of childbearing age in the period before pregnancy to improve health-related outcomes for women and children. Specific topics outlining preconception care will be stated on another slide. Preconception care is not a new concept. In the 1980s, leading organizations including the Institute of Medicine and the U.S. Department of Health and Human Services emphasized this topic through calls for the improvement of preconception care. The U.S. Department of Health and Human Services Committee on Infant Mortality reported in 2013 a recommendation for preconception health to be a key element in improving the health of women before, during, and beyond birth, and in reducing infant mortality. The CDC, AAFP, and ACOG have recommended preconception care to all women of childbearing age to avoid adverse birth outcomes and to promote favorable behaviors prior to conception. Preconception care is a Healthy People 2020 strategy for preventing adverse birth outcomes and in improving women's overall health. Even the American Society of Addiction Medicine have noted the importance of preconception care alongside substance use management of women with addictive disorders. However, in spite of the consensus, reproductive health planning has not become part of the routine practice in care settings nationally, and the lack of preconception care is emphasized in women with substance use disorders by the increasing trends of drug-related adverse birth outcomes and count of unintended births. It is important to keep in mind that this care is not only to improve the well-being of women as a whole, but also to eliminate and reduce inequalities. Communication about preconception is lacking between women and their healthcare providers. A national ambulatory survey identified that only a small percentage of visits made by women of reproductive age included preconception or contraceptive services. And the lack of preconception care is emphasized in the women with substance use disorders by the increasing trends of drug-related adverse birth outcomes and the count of unintended births. However, while the training in drug addiction treatment is increasing, the comprehensive approach of women with substance use disorders preconception care need is not being addressed. Identifying the reproductive needs of women through substance use treatment centers is a holistic way to optimize women's health and to prevent unintended births. The separation of the treatment systems for substance use disorders and general health care has historical roots. However, now is the time to be innovative and adapt holistic treatment plans to women with a substance use disorder. Action is needed to engage and inform women about their reproductive health. Preconception care is important for every woman, whether planning a pregnancy or not. It is an essential point of care focused on planning for the future and assisting women in taking the next best steps to get there. In reference to the documented unmet need of preconception care among women with substance use disorders, efforts focused on increasing women's knowledge of reproductive health planning as well as toward the efficiency of contraceptives should be explored. However, for providers to take a step further in bettering the health of a woman, an awareness of present biases about women with substance use disorders must occur. In addition to that, the barriers and/or triggers of women with a substance use disorder that could interfere with their reproductive autonomy should be explored. Reported reasons that interfere with the reproductive health of a woman can be described as patient, provider, and/or system barrier. A few patient-level barriers include feeling marginalized as a user in healthcare settings, misperceptions about fertility, being unaware of the need for preconception care, a history that involves intimate partner violence with reproductive coercion, a fear of losing custody of their children, or a fear of or history of forced treatment from a provider. And outlining this point is the importance of health equity promotion. There is a historical context of minorities receiving unethical reproductive care, and from that history, the consciousness regarding their reproductive health has been impacted. Provider or clinic barriers that may be attributed to the lack of women with substance use disorders preconception care includes a misunderstanding about the risk of contraception in identified high-risk patients, misperceptions about the risk of infection and use of LARCs in high-risk patients, as these reputations are not evidence-based, especially considering long-acting reversible contraceptives, LARCs, are particularly suitable for women with substance abuse issues, as they are set-and-forget methods and do not require daily compliance. System barriers that can create an obstacle in women accessing services include the cost and expertise required to deliver contraceptive services, women being automatically referred to external services or having care postponed until out of treatment, as many women will not follow through with these appointments. Therefore, the integration of preconception care into drug treatment services is vital. What is important to be aware of is that women value a trusting relationship with their providers. They appreciate when providers initiate discussions about their goals and when their values are addressed. Preconception care is an opportunity to discuss reproductive desires, feelings, and goals, and most importantly, an opportunity to empower their reproductive life. A way to promote the reproductive autonomy of women is through shared decision-making. The One Key Question is a shared decision-making tool developed by the Oregon Foundation for Reproductive Health, and it is a part of the Power to Decide campaign to prevent unplanned pregnancy. Through this simple patient-centered tool, providers are able to identify the preventative reproductive needs of women at risk of being pregnant. It is endorsed by the CDC, American Public Health Association, and ACOG as an appropriate and effective reproductive life planning strategy. For more information on the One Key Question, please visit the Power to Decide web link. The One Key Question asks women, would you like to become pregnant in the next year? There are 4 possible answers to guide the visit. The question is non-judgmental and supports women who want to become pregnant, those who do not, and those who are uncertain. Through this model, the practitioner offers relevant information, counseling, and referrals that meaningfully address each woman's answer. It is also important to be aware that through the One Key Question approach, not all situations need to be addressed. Yet, they will be identified and set the groundwork for future visits. This care does not need to be delivered as one specific package. The care contributes towards improving maternal and child health outcomes. It also contributes to improving the health and well-being of women in other areas of public health, such as nutrition, mental health, intimate partner and sexual violence, and substance use. Selected preconception interventions or referrals can be included in the delivery mechanisms that best suit your clinic. In reference to the One Key Question algorithm and the CDC's preconception care algorithm for women living with HIV, a basic high-risk algorithm was constructed to help guide your practice on how to approach answers to the One Key Question. Displayed is the starting point, One Key Question, and the 4 possible answers. The answers yes, okay either way, and unsure start with a conversation to outline the importance of the woman's treatment and the importance of empowering her health before conceiving. In addition, the answers no, okay either way, and unsure start with a discussion highlighting her thoughts on contraceptives and the importance of optimizing her health to prevent an unintended birth or risk of a child born with NAS. Ultimately, an emphasis on the importance of a woman's sobriety and wellness is vital. Through the shared decision-making tool, the needs and goals of the women should be prioritized. However, the need to reduce the negative birth outcomes and optimize over health should be heavily encouraged. Therefore, contraceptive access and needs should always be introduced. Providers must be cautious about imposing a preconception care plan for birth control on patients. The goal is to use shared decision-making to establish rapport and grasp onto a better understanding of the woman's goals and reproductive awareness. Therefore, non-coercive contraceptive counseling and an option to have a prescription for contraception, contraceptive education, or contraception plan, or a contraceptive plan should occur. To guide the women toward empowering their health and sobriety, a full range of effective contraceptive options, including but not limited to LARCs, should be explored. IUDs and the subdermal contraceptive implant are described as LARC methods. These are the most effective and cost-effective reversible methods available. Their effectiveness also relates to the fact that it is a set and forget method, perfect for women on the go and who are identified as unlikely to comply with user-dependent contraceptive options. Women with a substance use disorder have been found to have a preference for long-acting reversible contraceptive methods. However, are hesitant towards LARCs due to their limited knowledge and or preconceived notions about the effectiveness of these methods. This evidence confirms the Hawkins truth that women need effective preconception care counseling and interventions. To assist in the implementation of preconception care to your practice, additional resources are available, including but not limited to the resources displayed on this slide. To guide your practice in contraceptive counseling, the following tools are available. The U.S. Medical Eligibility Criteria for Contraceptive Use has a chart created by the CDC that addresses a select group of common conditions. This is available online and through a mobile app. The U.S. Selected Practice Recommendations for Contraceptive Use, updated by the CDC in 2016, speaks to a select group of common yet sometimes controversial issues regarding the initiation and use of specific contraceptive methods. This is also available online and through a mobile app. Bedsider.org is a free birth control support online network that provides users with tools to explore and compare all available methods of contraception and to view videos of women's contraceptive experiences. The page has several online resources and offers a provider portal. So how can preconception care be intertwined into your visits? The care can be started through one question and structured into a way that allows quick referrals, advice, and various opportunities for encouragement. Integrating and coordinating healthcare across systems leads to more opportunities for prevention and early interventions. Therefore, this service can be delivered by a wide range of providers. Reproductive life plans can also be assessed through a self-administered survey or assessed during a visit. With limited resources for prevention and treatment, it is crucial to extend resources to reach the most patients possible. Discussing future reproductive goals can encourage women to change their behaviors involving substance use, their contraceptive choice, and various other behaviors. Women in treatment programs are guided on the idea of improving their overall health. However, their reproductive health is not being addressed. Take a stand and contribute to the reproductive health of women by providing preconception care. Through a comprehensive, non-judgmental, non-coercive, shared decision-making approach, women can be provided information to a full range of contraceptive options and prenatal care. We can educate and empower them to decide the if and when to become pregnant. Thank you for completing the Preconception Care of Women with Substance Use Disorders module.